Imagine checking your blood pressure every week for years, taking your medication exactly as prescribed, believing everything is under control. But what if you've been measuring the wrong arm the entire time? What if a simple difference between your left and right arm could reveal information about your heart and blood vessels that you've never been told? Research has shown that a consistent blood pressure difference between arms may be associated with an increased risk of cardiovascular disease in some people, yet millions of adults have never had both arms checked during the same visit. Today we're going to answer some very important questions. Which arm should you trust? How much difference is considered normal? When should you speak with your doctor? And how can you measure your blood pressure correctly at home? Stay with me until the end because I'll also show you the simple 7-day method many healthcare professionals recommend for getting more reliable home readings. Let's begin. Why your arms can give different numbers. Most people assume that blood pressure should be identical in both arms. In reality, that's not always true. Blood pressure is measured in the brachial artery of each arm because the arteries branch differently from the heart, and because our bodies are not perfectly symmetrical, small differences are common. For many healthy adults, a difference of just a few millimeters of mercury, often less than 10 millimeters of mercury, is considered normal. However, when that difference is consistently larger, it may deserve further evaluation. Large differences can sometimes be associated with conditions affecting blood flow, including peripheral artery disease or narrowing of major arteries. That doesn't automatically mean something serious is happening, but it does mean it's worth discussing with your healthcare provider. What research has found: several large studies have examined blood pressure differences between arms. Researchers found that people with a persistent systolic difference of around 10 to 15 millimeters of mercury or more may have a higher risk of cardiovascular disease compared with people whose readings are nearly identical. It's important to understand what this means. A blood pressure difference is not a diagnosis. Instead, it can act as a marker that tells doctors to look more closely at overall cardiovascular health. Think of it like a warning light on your car dashboard. The light isn't the problem itself, it's telling you something deserves attention. Which arm should you use? This is one of the most common questions. Medical guidelines generally recommend measuring blood pressure in both arms during an initial assessment. If one arm consistently shows a higher reading, healthcare providers usually use that arm for future measurements and treatment decisions. This helps ensure blood pressure isn't underestimated. Notice the key word, consistently. One unusual reading doesn't tell the whole story. Patterns matter much more than single measurements. Common mistakes. Many people unknowingly make mistakes that affect their readings. Some of the most common include checking blood pressure immediately after walking upstairs, talking during the measurement, crossing their legs, using the wrong cuff size, keeping the arm below heart level, drinking coffee, or smoking within 30 minutes before testing. Even these small mistakes can change the reading significantly. The correct way to check both arms. Here's a simple method. Rest quietly for 5 minutes. Sit with your back supported. Keep both feet flat on the floor. Support your arm so it's level with your heart. Take one reading on one arm. Wait 1 to 2 minutes. Repeat. Then measure the other arm using the same process. Record every number. Repeat this over several days. You're looking for a consistent pattern, not a single perfect reading. Let me tell you about Robert. He's 68 years old and had managed high blood pressure for nearly a decade. At home, he always checked his left arm because that's what the monitor instructions suggested. During one visit, his nurse measured the right arm first. The reading surprised everyone. After repeating the measurements on different days, the right arm consistently showed higher numbers. His doctor decided to use that arm for future monitoring. This didn't automatically change his diagnosis, but it gave a clearer picture of his cardiovascular health and helped guide future care. Sometimes better information leads to better decisions. If you've never compared both arms, ask your healthcare provider to do so at your next appointment. If you're monitoring blood pressure at home, spend 1 week checking both arms under the same conditions. Write everything down. If you consistently notice a significant difference, especially around 10 to 15 millimeters of mercury or more, don't panic. Simply share the information with your doctor. It may help determine whether additional evaluation is appropriate. Blood pressure isn't just about one number. It's about patterns, consistency, proper technique, and understanding what those numbers really mean. A few extra minutes today could give your healthcare provider a much clearer picture of your cardiovascular health tomorrow. If you found this video helpful, subscribe for more evidence-based health information designed especially for adults over 60. Stay healthy, stay informed, and I'll see you in the next video.